almost everyone can call themselves entrepreneurs, but not everyone will be able to connect all the pieces the way they're supposed to be connected to deliver a solution. My name is Ayub Robert, the CEO and founder of AMICUS Wellness Flags, a healthcare startup that is committed to ensure that healthcare is affordable, accessible, and preventable to all Kenyans. We have built a doctor-led chatbot that integrates and ensures that there is continuous engagement between users and their doctors, collecting symptoms and cumulatively presenting this to the doctors for interpretation, which can actually be used to detect early sickness or any signs of early sickness. SHA finances a lot of, take care of the cost of a lot of conditions, but the requirement that you have to pay all the 12 premiums upfront makes healthcare not accessible. That is one. That came out from our visit in community-based organizations as supporting the community-based organization. That came out.
My name is Francis Osombewa. I've been on medication for pressure for the last 13 years, and 3 years later I realized that I was diagnosed with a kidney failure. When I was diagnosed with kidney failure, I started doing dialysis. I was doing 3 sessions, which I was paying 1 session cash and 2 sessions SHA used to pay for me. And I realized on the process of getting the people who are suffering with kidney failure, they are having a problem because of medication. On the journey of dialysis, I realized that most patients do suffer because of funds. Like for me, it took me 3 months for me to start treatment because of cash. Anytime you want to see a doctor, you get doctors have different prices.
Imagine you are feeling heavy because you didn't plan so well. You're working, probably being paid 20,000 plus, and then you're diagnosed with a kidney failure, for instance. Where would you start? How would you start? You would run to your friends and you would go to WhatsApp and they would raise funds for you. So before awareness, most people don't know the strength of SHA registration, but SHA takes a lot of liability away. So when you're doing raising funds, they would contribute the amount on WhatsApp, but this liability is not sustainable. You cannot sustain contribution every single time. The best was to contribute for the SHA registration, which is 12,600. I think it's 600 per month. For the year is 12,000. When you contribute 12,000, you've actually supported this patient the entire year. We come in by, if I contribute 50 shillings, 100 shillings, when this patient is registered to SHA, I can actually meet other people supporting this patient and go and tell him we are with you, or go and tell her we are with you. So that was the greatest innovation in our app, where we are using it for people, a platform where they can actually take care of a complete stranger and feel good about it without even mentioning it to any other person. Personal support on WhatsApp. That is our biggest feature on our chatbot. Say Grow Movement came at the right time, when I had just pivoted into including the crowdfunding into our solution. And you need to look at an end-to-end delivery. And end-to-end delivery is anchored on a network. It is at that point that I realized I'm not building a solution. I'm building an ecosystem. I'm putting together a platform that is going to bring patients, donors, CBOs, FBOs, and tech guys to deliver healthcare to that one person who is in dire need of it.